Communication 110, informative speech. I'd like to introduce my audience, Dennis Knudsen and Cody Knudsen. Imagine being told by a physician that your family member is no longer safe to live at home. How would you feel about hearing this? The Pacific Northwest Extension publication in 2003 states that the decision to place a family member in a nursing home is one of the most difficult decisions that you and your family will ever have to face. I'm Deb Knudsen, and as a home care RN, I come across this scenario quite often. Today I will discuss nursing home placement of a family member. I will discuss about how they determine that your family member is not safe at home, how to go about picking a nursing home, as well as how to pay for a nursing home. So, you're probably wondering, well, how do they determine that my family member is not safe at home? Washington Senior Care 2010 states that they go by these criteria. The person has a hard time doing assisted daily living activities, which is getting dressed, bathed, going to the bathroom, cooking, cleaning, laundry. Person also may be unable to take the medications they have as prescribed, has memory deficits, or cognitive decline. They may be disorientated, confused, frequent falls, may be incontinent, person may be wandering outside their home. Another indication is that the caregiver is no longer able to care for that person because of immobility or behavioral issues. So now that we determine our family member is safe at home, how do we go about picking out a nursing home? The Centers of Medicare and Medicaid in 2011 has these recommendations. They state that you should visit the home various times a day, various shifts. Note the resident to nurse aide ratios. Ask how many patients that these nurse aides have. Ask about the acuity levels of these residents. Higher acuity level means more care is needed, and then thus more aides needed to care for these patients. Note how staff, especially CNAs, respond and react with staff members and residents. Note if there's an odor in a facility. Here's a good resource. Go to Nursing Home Compare. It's at medicare.gov, and it has the list of every nursing home that you're looking at, their surveys from this year to the past years. It's a good resource to check out how they're doing on their state health surveys. They're done every year. It's updated every 6 months. Highly recommend that website. So now that we picked out a home, how do you go about paying for a home? Travis County Public Health nurse that I interviewed states there's 4 ways that a nursing home can be paid for. You can go through Medicare, Medicaid, long-term care insurance, or private pay. Medicare, however, can only cover if you've been in the hospital 3 days, and it only pays for 90 days of nursing home stay. Medicaid, you have to qualify for. Too high income or too many assets, you may not qualify. The Medicare states that 7 out of 10 residents are paying through Medicaid. Private pay is paid out of pocket. So now that we have figured out how we're going to pay for this nursing home, we can move our family member in. Nursing home placement of a family member is considered one of the hardest decisions that a family will have to make. Today, I have discussed how one determines their family member is not safe at home, as well as how to pick a nursing home and how to pay for it. The decision of nursing home placement of a family member is a decision that many of us hope we do not have to do. However, with careful thought and planning, you do not need to feel guilty or bad about making this decision.